Hi class, my name is Amanda O'Brien, and we're going to be discussing the confidentiality that employees that are working for our healthcare system are responsible for. It is the responsibility of all healthcare employees to ensure the safety and privacy of patients' information. The HIPAA privacy rule states that the HIPAA privacy rule establishes national standards to protect individuals' medical records and other personal health information and applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. The rule requires appropriate safeguards to protect the privacy of personal health information and sets limits and conditions on the uses and disclosures that may be made of such information without patient authorization. What is considered health information? Patient demographics, so a patient's address, name, any identifiable information, their medical histories, test and laboratory results, insurance information, their medical record number, a social security number, date of birth, anything that can identify a patient. When can you access information? The employees are only permitted to access patient information if it relates to your job. So if you are registering a patient into a radiology test, you are able to access that patient's account and information. If you are looking to get a test authorized, you are able to pull that patient's account information to get that authorization. If you see or hear patient information that is not related to your job, remember that this information is confidential. If you're in the cafeteria or walking in the hallway and you hear a doctor discussing a patient information with a nurse and you are not in direct care with that patient, it is your responsibility to not speak of it. Keep it confidential. That means in the workplace and out of the workplace. You do not take information to your family, your friends, or other employees that are not involved in this patient's direct clinical care. How can you protect patient information? Whenever you get up from your desk, lock your computer. Do not share your login passwords. Do not talk to other employees about a patient if they are not involved in that patient's care. This information should be disclosed on a need-to-know basis. Do not leave faxes or printed patient documents unattended on public machines, and that includes printers and faxes that are shared by other employees of the office. It does not need to be a machine that is accessed by patients. If it is not your private machine, do not leave patient information on it. Make sure all patient information documents are placed in the designated disposal bin. Hospitals and healthcare facilities usually have a shred box where patient information is disposed of. Do not put it in the recycling bin or a regular trash can. Accounting of disclosures of personal health information. This is a summary of where a patient's personal health information was disclosed and who has received and accessed their information. The IT departments track who goes in, what accounts, when they go into these accounts, and what they were looking for in these accounts. If a red flag is raised, the IT department is able to pull your history of what accounts you have accessed and what you were doing in those accounts. It is every employee's responsibility to be alert to unethical behavior. If you suspect that an employee has violated this rule, it is the duty of that employee to report. If accused employee is found not guilty, there will be no negative action toward the employee that reported. We are in this all together, and patient safety is our top concern. If you are found guilty of this privacy rule, immediate termination will be implemented.